I've never in my entire 33 years seen something that's so effective when it comes to suicide prevention. That is heartwarming to me. I'm so glad we stayed with it for 10 years.
The first of its kind study looks at an evidence-based suicide prevention approach for people in jail. Researchers looked at both the Genesee County Jail and the Rhode Island Department of Corrections and tracked suicide outcomes for a year after the inmate's release. This was a federally funded trial called Suicide Prevention for At-Risk Individuals in Transition. Research shows 1 in 5 adults who die by suicide in the United States have spent a night in jail in the past year. This looked at how prevention programs can be used to reduce suicide attempts. During a town hall Monday afternoon, Genesee County Sheriff Chris Swanson sat alongside Jennifer Johnson. Johnson is the founding chair of MSU's Charles Stewart Mott Department of Public Health. She says the research started more than a decade ago.
One of the biggest challenges in suicide prevention is finding people at risk when they're in risk, especially people who aren't well connected to health care.
Johnson telling Mid-MichiganNow they found there weren't any effective interventions for suicide prevention for the jail population, and they identified the first is an approach to prevent suicide.
It is called the Safety Planning Intervention.
During this intervention, researchers found conversing with the individual is key.
You don't have to try to talk them out of it. You don't have to judge them. You don't need to do any of that. Just listen and then tell them you care about them and go with them to try to get some help or call somebody together.
Those follow-up calls reduce suicide risk in the community by half. The study followed 800 at-risk individuals between the Genesee County Jail and the Rhode Island Department of Corrections. Half received the standard post-release care. The other half was provided this intervention program.
When you look at that simple act and having somebody who's there that you can pick up the phone in crisis, just like when somebody's going through addictions, you have a sponsor, you have a coach. Same thing with mental illness. If that's duplicated, it doesn't matter where it's being needed, it works.
Genesee County Sheriff Chris Swanson says that when people are released from jail, there's really no wraparound services.
In this particular study, we built those relationships while they're incarcerated, and we stayed with them as they left the jail. So there was a point of contact, there was follow-up.
During that follow-up, they found that the people who received the intervention showed a 55% reduction in suicide attempts and 42% overall decrease in suicide-related events.